Good evening. I'm Sarah Jo Best with Lincoln Trail District Health Department. As of press time today, there were a total of 71 cases of COVID-19 within the Lincoln Trail District Health Department area. The total number of cases per county is as follows: Hardin 31, LaRue 4, Marion 13, Meade 5, Nelson 15, and Washington 3. Currently, 62 cases are on home isolation or have been released from monitoring. Governor Beshear recently announced benchmarks Kentucky must meet before easing restrictions to reopen the state's economy while keeping Kentuckians safe. These steps will incorporate White House guidelines and advice from public health experts. Meeting these benchmarks will initiate small steps the governor will take to begin easing restrictions. The 7 benchmarks include: 1. Data that demonstrates a 14 consecutive day decline in the number and rate of new cases. Kentucky is not currently on a decline. According to the governor, we cannot go down until we stop going up. 14 consecutive days may not be as simple as it seems. The beginning of the 14 days does not hinge on a set date, but will be decided by data. Benchmark 2. Increasing testing capacity and contact tracing that would allow even those who do not have symptoms to be tested. In our area, the decision to test individuals is based on a 2-tiered system. This system allows us to prioritize testing for those who are at highest risk. This system is required because there are not enough testing kits to meet current demand. However, this is rapidly changing. As of 5 p.m. today, Governor Beshear announced that Kroger testing sites in Louisville and Lexington will be open to everyone. These locations were chosen to target the African American population who suffer higher fatality rates than the general public. The sites will operate Monday through Friday, starting April 27th, and will run for 2 weeks. Until testing capacity increases in our area, the Lincoln Trail area will still operate using the 2-tiered system. Tier 1 includes individuals with active symptoms such as fever and cough and/or difficulty breathing, who are healthcare workers, first responders, people over the age of 60, or currently living in a congregate setting such as a nursing home or jail. Tier 2 includes those with active symptoms who have chronic medical conditions, for example, asthma, diabetes, COPD, liver or kidney failure, or a compromised immune system. Benchmark 3. Personal protective equipment. Personal protective equipment must be available. Personal protective equipment continues to be in short supply across the healthcare system. There is still great demand for gowns, gloves, face masks, and face shields. Individuals or groups who have additional PPE are encouraged to visit kycovid19.ky.gov for guidance on how to donate these items. Benchmark 4. Availability to protect at-risk populations. Kentucky has a large population that is considered high risk because we are not healthy overall as a state. We lead in lung cancer, obesity, heart disease, and diabetes. Many of these diseases have been defined by the CDC as conditions that put people at higher risk for COVID-19. It is imperative that those at higher risk continue to practice physical distancing and stay healthy at home until more definitive measures are in place to treat or cure COVID-19. Benchmark 5. Availability to social distance and to follow CDC guidelines on large gatherings. It is important to remember that many people do not exhibit symptoms with COVID-19. This makes physical distancing especially important. The virus is very contagious and is transmitted by coughing or sneezing respiratory droplets into the air. A single cough or sneeze can produce over 3,000 droplets. If you are within 6 feet, those droplets can land in your eyes, nose, or your mouth. We are not yet at the point to end physical distancing and go back to work, church, and concerts in the previous manner that we did before. Benchmark 6. Preparedness for a possible future spike in cases. In order to do this correctly, our number one concern must be safety. Returning to our regular activities too soon could cause a spike in the cases and could overwhelm hospitals, emergency departments, urgent cares, and local healthcare providers. Patient survival rates would be lower because needed medical resources wouldn't be there. However, if physical distancing is practiced, transmission within the community is greatly reduced and medical resources are available to meet the demand. We must ensure that we have the medical capacity to treat any future spikes in COVID-19 cases. In addition, avoiding this second spike will restore our economy faster. And the final benchmark is closer to a vaccine and treatment that can be used to combat COVID-19. Several companies are testing antiviral medications. These medications target the virus in people who are already infected and are likely to be approved before a vaccine, which typically takes longer. The development of a vaccine requires 3 phases of clinical studies. This pushes the date for widespread use to a year to 18 months. Finally, the FDA has created a process for an experimental treatment using blood plasma from patients who have recovered from COVID-19. The theory is that the plasma contains antibodies that will battle the virus. In closing, I ask everyone to continue to have patience. I know this is hard. We miss our families and our normal routines. We are all anxious for the day that we can start taking steps toward a new version of normal. We just have to be cautious and protect the most people. Thank you.